Three, two, one, and we're live. So, hi everyone. For those of you who have yet to join the stream, and for those of you who are tuning in now, give this stream a like, a love on Talking Live with Macy. We want to hear from you. And more importantly, we want you to share this with someone who can and will benefit from it. Share this stream, share Talking Live with Macy, especially this week's session on breast cancer. It's in conjunction with Pink October. We'll wait for 15 people. So continue to share this. And like I mentioned in my postings, we're giving away a 3D mammogram and ultrasound, two of it to be given out by Prince Court Medical Center. So please share this with someone who will truly benefit from it, and also to raise awareness on the breast cancer conversation. So we already have 15 people. It seems like a lot of you are interested in today's stream. I'm really, really happy about that. So welcome to Talking Live with Macy. Thank you for spending your afternoon, your Sunday afternoon here with us. More importantly, we hope that you're staying healthy, staying safe, and if you don't have to go out, staying home. So today, I see that from last week to this week, the cancer conversation and the health conversation has garnered a lot of interest amongst all of you, which has made me really, really happy. That means you care about your health. You care enough about yourself to want to know more about your health. So today's topic is on the what, the why, and the how of breast cancer with an expert. So let me go through the breast cancer statistics here in Malaysia first. So breast cancer is the most common cancer amongst women here in Malaysia. And 64% of them actually get it from the age of 40 to 60. I got this from Breast Cancer Foundation. And from Cancer Research Malaysia, they found that 1 in 20 women develop breast cancer because they inherit the BRCA1 or BRCA2 gene. And currently, the best way to detect breast cancer is through a mammogram. So this is from Cancer Research Malaysia. But of course, to tell you more, we have an expert who is in the field for many, many years already. I've heard so many good things about her. Before that, please stay with us till the end because we have 2 3D mammograms and ultrasounds to be given out by Prince Court Medical Center. So thank you, Prince Court, for sponsoring these 3D mammograms and ultrasounds and also bringing our expert on the show. So our expert, like I said, she is really experienced in the field. And she's a consultant breast and endocrine surgeon. She specializes in oncoplastic breast surgery. And a lot of my young cancer survivors actually have been operated by her and actually go to see her. She's none other than Dr. Harjit Kaur.
Hi,
Thank you, Dr. Harjit. Hi, Dr. Harjit. Thank you so much for joining me today on Talking Live with Macy. And like I said, I've heard so many good things about you, and I thank Prince Court Medical Center for bringing you on the show. So, by the way, to all of you watching, I've heard that she looks gorgeous even when she's doing surgery. Yes, that is what Aimee asked me to tell you. So a few of my young cancer survivors actually, like I said, go to see her until today. So guys, if you have questions, please ask them now so I can pick them up towards the end. We're going to start the session now with Dr. Harjit Kaur. So Dr. Harjit, thank you once again for joining us. I'm going to start asking the questions.
All right.
All right. So Dr. Harjit, you are one of the most experienced breast and endocrine surgeon here in Malaysia. Can we know what set you on this career path?
Oh, actually, it was a little bit of a by default, actually. Many years ago, when I was a young surgeon in Ipoh Hospital, being the only lady, female surgeon in the whole department, I was automatically put to run the breast clinics. And I think it was at that time that I saw the frustration and the emotional issues that a lot of these breast cancer women patients were facing. Especially at that time, many years ago, there were no options of reconstruction of the breast. So many women actually defaulted treatment because they just didn't want to lose their breasts. And as a result, many lost their lives instead, which was very, very sad. And that sort of gave me a resolve to take up reconstructive surgery. That was the original plan, actually, to be a plastic and reconstructive surgeon. But somewhere along the line, I entered into the breast and endocrine field, and I was training under our now Tan Sri Noor Hisham. I was one of these first
Oh,
few, yes, I was one of his first few trainees in the breast and endocrine program. And then I did my breast fellowship in Australia, where I learned all about reconstruction, the sentinel node biopsy. And it's been like this ever since, and I have no regrets, no looking, no turning back. I love what I do. I love, treating the women and my patients and hoping I can make a difference in their lives.
thank you so much. You have been making a huge difference. So many good things about you from my friends. Now, from your experience with breast cancer patients, are the patients getting younger nowadays?
Yes, for some reason, it's not just a problem we see in Malaysia. Actually, it's a global problem. Our colleagues all over the world basically say they're seeing the same. The cancer being seen in the younger women nowadays, as young as in their 20s. So most of my average patients, to be honest, are in their 30s and 40s, and many are also in their 20s. We don't really know why this is going on and what's exactly happening, but I feel it's something multifactorial. It's probably our lifestyle choice, the way we are living our lives these days, a very fast pace, full of stress, lack of sleep, poor nutrition, not eating well, not eating at the right time, too much of fast foods, processed foods, it's all the quick, everything very quick, it's moving very quick. And I guess in some way it takes a toll on our system, on our cells, and things go wrong. And also I think we're also surrounded by technology, our handphones, our computers. We are surrounded by this ball of radiation all around us. I guess it all has something to do with it. I mean, I don't have the answers, but nobody can give us a definite answer till today. But I guess that we have to start taking care of our life from young. We have to stop giving our young children handphones, and put in front of them in their prams. I think these are the sad things I see these days. A small little child sitting in the pram will have an iPad. I mean, all these are radiational gadgets. And I think these are the things we need to cut down, and we need to, have a good, healthy lifestyle, cut down on the weight, eat well, exercise regularly. We need to start doing that from young. We have to inculcate that in the young.
I agree. I totally agree. Actually, so that you are seeing younger patients.
Yeah.
That's because I agree. I think it's also because of the lifestyle. But also, could you share with us what are the symptoms of breast cancer?
Well, the earliest of breast cancer will have no symptoms. So don't look for symptoms. That's the whole idea of the breast awareness and screening. So that's why you must go and get yourself checked every year without fail, because breast cancer has no symptoms. It is painless. And by the time you actually feel a lump in your breast, that's how it comes about most of the time, a lump, it's probably about 6 months or a year too late. It would have been growing in you for the last 6 months to a year, depending on the type of cancer it is. So, of course, breast lump pain is a late presentation. By the time you get pain, it's often, the lump is either very large or it's causing some inflammation in your breast, which is not a very good sign. Nipple retraction. If you notice your nipple is changing, it's starting to get pulled in when originally it was outside. Now, that's not a very good sign. So, and skin changes. You need to look for skin changes. A change in your skin texture. You start noticing that, some parts of your skin is being pulled in, puckered, anything at all. And even asymmetry. If you feel one of your breasts is suddenly getting larger than the other, or in fact one is getting smaller than the other, that's actually also a very worrying sign. It tells you that there's something brewing in your breast. And of course, nipple discharge, which is also a possible sign of underlying problem in your breast. But again, like I said, I cannot stress enough, don't wait for signs and symptoms. You need to check yourself, because you do not want to have signs and symptoms. You need to want to catch your cancer, if you're going to get it, at the earliest possible, because then you can be cured. That's what it's all about.
That's true. Very, very true. So let's talk about those that, didn't manage to detect it early. What happens then after a breast cancer diagnosis?
Well, when we talk about breast cancer diagnosis, we're talking about both on imaging as well as a biopsy, which would have been done to confirm that we are definitely dealing with a breast cancer and what type of cancer it is. So now, I mean, there's no sugar coating it. I always find that is the worst part of our job is to break that news to a patient that, you have cancer. I mean, there's no easy way to tell somebody that you've got cancer. So I always believe the best way is the straightforward way. Look, this is it. Now let's get on with what we can do and what we should do. So when a patient is diagnosed, I think it's very important for them to always come with someone else, never come alone for your diagnosis at least, because many a times they shut down. By the time I'm speaking to them, I think in 10 minutes they are already shut down, emotionally, sometimes physically, everything. So you need to have someone with you who will take over and at least listen to what needs to be done, because many a times they would have forgotten everything by the time they left the room, and they'll be in a daze. I see that very often in many patients. So it's good to have someone with you who will listen to the doctor, to what the plan is, and then come back again for a second round. It's never a one-off thing, because there are many things that you may not have understood well. You may not have understood what needs to be done, your options, and these are the things that we would sit with the patient and explain all their options, because there's no similar management for every patient. It depends on the size of your tumor, your age, the type of the tumor that you're having. So the whole idea of managing a patient is actually very streamlined. Each patient gets their own particular management plan. And it's never the same for all patients. So that's why it's very hard sometimes when patients compare notes and they say, oh, how come I had this and you didn't? And how come you got this and I didn't? I do have some of my patients coming back and saying, my friend said that she had chemo. How come I didn't need chemo? How come I did? They thought they got shortchanged in their treatment. So I always explain to them, like, it's never the same for everyone. Everyone is different. The cancers are different, the type, your age, what you need, all that is very different. So it's streamlined. So you have breast conserving surgeries, you have mastectomies, mastectomy with or without reconstruction. That's an option a patient is always given. And the earlier you catch the disease, the better your options of saving your breast. And the treatment becomes very simple these days. Very small surgeries. You're home the next day. Treatment is minimal. And for the older women these days, we even do intraoperative radiation, where they can have everything done during surgery, and that's it. Their treatment is complete. They don't have
That
any treatment after that, except for perhaps just the tablets, the anti-hormonal tablets.
that's for all the early detection
Early,
ones, right?
early cancers that are smaller than 3 centimeters.
Okay. So
Yeah.
do all breast cancer patients have to undergo breast surgery?
Well, I would say majority of them would have to, invariably. The question is just whether what type of surgery, whether it's a small surgery or a slightly more radical surgery. It will depend very much on the stage of their diagnosis when they come, how big their tumor was to start with, and what the patient actually wants. I have patients with small tumors where I tell them, look, I can save your breast, you don't need to worry, but they go like, no, 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 I want the breast off. So you see, it's a personal choice. It's not for me to tell them, no, 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 you keep your breast. It's what makes them comfortable and what they feel they're happy with as well. Because at the end of the day, it's all not just a physical thing; it's also the mind, the emotional aspect. There's so many things to deal with in a patient who has cancer. So there's no real definite plan for each patient. But there are some occasions where, like to date, I have perhaps about 3 or 4 women who I'm still looking after who have not had surgery. One is in her 80s and
Wow.
one is in her 90s. Yes, and so they were fairly frail, and the family was so afraid of them having surgery. So they were fortunate to have what we call a hormone positive cancer. So I was just treating them with oral anti-hormonals and monitoring them very closely. And both of them have responded beautifully in the sense that the cancer has shrunk literally to the point where I can hardly see it anymore in the breast. So I just keep following them up regularly just to make sure they're perpetually in remission, but just on the oral medication. And they're doing very well, both of them. Yeah.
Wow, I'm so happy to hear that. But what are the methods of early detection for breast cancer would you recommend?
I think the gold standard we have is still the ultrasound, the mammogram, and the MRIs. MRIs are good for screening, especially those with high risk. That means those with strong family history, because their screening need to be started earlier when they are about 35 years of age. Whereas most women in general will start getting their mammograms at 40. So at 40, you should get your first baseline mammogram. It's very important. And ultrasound, you start when you're 25 and above. It's absolutely safe. There's no radiation. A simple ultrasound of your breast once a year can go a long way, because at least you'll have that sense of comfort that, look, okay, good, I've done my ultrasound and I'm sort of free of anything in my breast for the year. And if you do this every year, if God forbid you're going to get cancer, we're going to catch it very, very early at its smallest. And then your treatments become so easy and you can at least be assured of a cure. And that's very important. And
That's so true.
mammogram as well. Yeah, very, very similar.
So I would like to tell all of you who are watching this, you always ask me about early detection. Dr. Harjit Kaur gave a nice age recommendation. So anybody above the age of 25, please go for your regular ultrasounds once a week. And like she mentioned, for those oh, so once a year, sorry. Yes, once a year for your ultrasound. And for those of you who are above 40 and above, go for your mammogram once a year. And I always believe in early detection, and like what Dr. Haji Kaur mentioned, at least you can detect it early and it can save your life.
Yes.
So, Dr. Haji Kaur, a lot of people are afraid of mammograms. Do you have anything to say about that for everyone?
Honestly, let me tell you, I do my mammograms every year without fail from the time I was 40. Okay, even though I don't have a family history of breast cancer, but I mean, as a clinician, I feel I should practice what I preach. And I can tell you that the mammogram machines over the years have become tremendously better and better, because I know from the time when I was in my 40s, they were a bit uncomfortable, the older machines. So they do give a discomfort. But the machines that we have these days, the new digital mammograms, they are fantastic. And, I won't say they're painful, neither are they painless, but it's a quick, short discomfort. Let's put it this way. Because the plates, when it comes down on your breast, yes, you're going to feel that compression. And it's really quick, because the machines these days sort of release the compression very quickly, because they're very, digital, modern, and more refined. And if you relax when you have your mammogram, honestly, you will not have any discomfort. It's when we are so tense because we are so stressed that we tend to get more of the discomfort and the pain during the mammogram. So please don't let that be a fear that will deter you from doing your mammograms, because honestly, the mammogram is so important. It can pick up your cancers at a pre-cancer stage where you can be assured 100% cure, and it's going to save your life. That's all I can advise you. Yes.
Yes, save it. The most important, it saves your life. Have you treated many metastatic breast cancer patients in Malaysia?
Yes, we do have many. I mean, some have come to me at the onset metastatic, unfortunately. I mean, they presented to us late. Then, of course, there are some of our patients who unfortunately develop metastasis along the way in their follow up. So they started off non metastatic, and then somewhere along the line, a metastasis occurs in their follow up. Now, well, it all depends on how bad the metastatic disease is. And these days, honestly, with the advent of much better treatment, the targeted therapies that we have, the chemotherapy, there are more women who are actually living at stage 4. And they're still, having a very good life, good quality of life, because we're able to keep the disease under control. We can't tell you we can cure you, but we can at least hope that if you respond well to treatment, we can actually get the disease kept under control. So the patient is actually living a good life, good quality of life, but with treatment. The treatment is ongoing along with them. That's how it works. So there are, yes, many, many women who are living with metastatic disease as well.
I see. All right. For those of you who are watching, please start asking your questions now, because I have one last question for Dr. Harjit Kaur. I see some of you already putting in your questions. So please go ahead, put them in so I can bring them up. All right. My last question for you, Dr. Harjit, is any advice or message for women out there in terms of awareness regarding their breast health?
I think the most important thing I can tell all women out there is please get to know your own breast. Very, very important. There are still many women out there who do not know what their own breast looks like or feel like. And no two women's breasts is identical. There are different types of breasts. Some women's breasts are very lumpy, some are very fatty, they're soft, some are firm, some are, it's different. So you need to know your breast. So unless you do your own regular self breast checks and know what your breast feels like, I'm not asking you to become doctors and search for lumps and look for lumps. All I'm saying is know what your normal breast feels like. Because unless you know what is normal, you will never be able to pick up anything abnormal. So if you know your breast well, and if you do this checking of your breast when you're showering, just a quick feel of your breast when you're showering is the best time to do it. And if you know your breast well, if something unusual crops up, a lump or any change, believe me, you'll pick it up because you know, hey, hang on, this wasn't here last month. I'm feeling something different now. So that's when you go see your doctor and get it verified, get it double checked, just to make sure that it's nothing. Don't just sit on it and say, oh, if I don't do anything, it's going to go away. No, it's not going to go away. So please, be a little proactive, go and get it checked because then you'll have peace of mind. If it's nothing, because 85% of the time, breast lumps are non-cancerous. So don't be afraid. If you feel something in your breast, don't panic. Because most of the time they are non-cancerous. So go get it checked, at least verified, and you'll have peace of mind that it's all good. It's nothing to worry about.
So the most important message that Dr. Harjit Kaur mentioned is get to know your breast. I
Yes.
think even for myself, I need to start doing that. Be
Yes.
more aware of it. Okay, thank you so much, Dr. Harjit. Those are the questions from me. I think there are a lot of questions for you from all of them watching. So I'll start with Chang Yen Lee. She says, "Hi, doctor. I'm 43 years old this year, and she just did her first mammogram at the age of 41. The result was dense breast for both, and she was referred to a breast surgeon for follow-up ultrasound. She says, thank goodness it was clear, but the doctor told her it could be genetic and ethnicity related, and that resulted in the dense breast. So she was wondering if doing breast ultrasounds until she's older or to try a mammogram again."
Well, many women have dense breasts. It just means you have more breast tissue than fat. It's not a bad thing. A dense breast is a breast that won't sag very early in life.
It's a good thing.
Yeah. But unfortunately, the mammogram images usually are not so clear. But here again is where I say that the newer machines that we have, especially the 3D mammograms, are wonderful for dense breasts because it can actually look at your breast very well. It takes away all the unwanted appearances, and the small little things are still picked up. So don't give up on the mammogram because go for your mammogram still at least every 2 yearly or 3 yearly. But follow up with ultrasounds every year, and go up for a 3D mammogram if you and that's probably going to be wonderful for you. And as we grow older, our breast will get less and less dense, and mammogram images then become clearer and clearer as we get older. Yes.
I see. Okay, that definitely answered her question. So Sheila said the next question is Sheila. She was recently diagnosed with breast cancer. I'm so sorry to hear that, Sheila. Last month. So the surgeon suggested to go for surgery first with sentinel biopsy and just did the surgery last Friday. And she said her lump was 1.3 cm. She's 45. She said some said she should have gone for chemo first before the surgery. She's quite confused. She asked which one is better, to go for the chemo, then the surgery, or surgery, then the chemo.
Well, I think at a 1.5 centimeter tumor, if it is in relation to your breast, is not large, and you were able to keep your breast, it is not wrong to have the surgery first. I mean, there are few ways of doing things. Sometimes we opt to do chemotherapy first for some patients, especially if their tumor is large. To the point that we may not be able to save the breast at that point, meaning breast conserving surgery will not give you a good cosmetic outcome. And if the patient chooses to want to keep her breast, here's where we do something called neoadjuvant chemo. So the chemotherapy is given first, and the tumor shrinks in size so that it gets to a size which makes breast conserving surgery more amenable and more cosmetically acceptable as well. Of course, these days there are a lot of new studies which are showing that the hormone negative, especially the triple negative breast cancers, even sometimes the HER2 positive cancers, they may benefit a little bit more with the chemotherapy first. and then followed up with surgery and radiation as needed. But actually, there's no real hard and fast rule. I think as long as you are treatable and you've got the right plan of management in place, there's no right or wrong. As long as the outcome is still good, that's very important.
That's true.
Yeah.
Sorry to hear that once again, Sheila. Dr. Hajit definitely answered your question, and hope that you won't be too confused moving forward and to get treated the best possible way. And the next question
Sorry,
is Sansan.
just for Sheila, sorry. Just be focused. Don't get too distracted by too many
Yeah,
things when you get your treatment. Be focused and get on with it, and move the right direction.
I agree. Now, Sansan asks, is breast cyst cancerous? She says some doctors suggest to do mammogram every 2 years instead of every year.
Well, if you don't have a family history, a mammogram is advocated 2 yearly with ultrasounds every year. And you mentioned something about breast cysts. No, breast cysts, if they're simple cysts, they are not cancerous. Neither will they
Okay,
ever become cancerous.
I see. Okay, that's good to note.
Yeah.
And Yogimbi asks, do we have to do annual mammograms even when we are old and elderly?
Well, women are living longer and longer these days. As I say, I do get cancers in 80 and 90-year-olds, and they're doing very well till today. So I think, yes, maybe every 5 yearly a mammogram after the age of 70, 75. There's really no hard and fast rule. But if you do your own regular self breast check, I think that's very important. And there's really no harm in doing a mammogram, maybe every couple of years, as long as you are healthy and you're well and you want to stay healthy.
Okay. Uh, that's good to note as well. So Sansan was also asking, she says some breast cysts actually regrows back after it's removed. Why is that so? And she asked, does taking HRT increase the risk of breast cancer?
Now, first of all, we don't operate on breast cysts. We don't remove breast cysts. We aspirate them because breast cysts is just fluid-filled spaces. They're not solid tumors. The lumps are different. So we never operate on breast cysts. And breast cysts is something hormonal. So as we grow older, it will gradually shrink and disappear. Majority of them, some might just remain, but they are no consequence. They may give you a little discomfort on and off, but they are harmless. So we don't operate on breast cysts. So there's no question of them coming back after surgery.
Oh,
So
okay.
yes. So sorry, I forget the second question you asked. She asked.
HRT, does it increase the risk of breast cancer?
Well, there's really no definite concrete proof that HRT increases your risk of breast cancer. But of course, when you are taking HRT for whatever reason, if it is important for your quality of life, just make sure that you do your regular mammogram checks. That's very important because HRT sometimes does cause your density of your breast to increase once again. Rather than decrease with age, it can actually increase. So it makes things a little tricky. So please make sure, as long as you do your mammograms and your ultrasounds every year, you're fine to take your HRT if you need to.
I see. Okay. Eileen asks, when do women need mammograms only? And then when do they need it to be coupled with ultrasound?
Well, my philosophy is you need both at all times because neither one is 100%. A mammogram has about an accuracy of about 96%, and an ultrasound also similar. There are times where a cancer can be missed on a mammogram and it's picked up on an ultrasound, and vice versa. So it's always good to do both. In the young, of course, like I said, when you're not up to the age for a mammogram yet, it's ultrasounds all the way. But once you're 40 and above, it's good to practice doing both.
Okay.
Yeah.
Thank you. The next question is Jenny Lim. She said she knew someone who was diagnosed with breast cancer while breastfeeding. So she heard breastfeeding reduces the risk of breast cancer. Is that true? Is that true? Wow.
I don't know whether to say it's a myth or it's a fact, but I mean it's definitely not 100%. Let's put it this way. Breast cancer has been of course breastfeeding has been known to be beneficial because as long as you're breastfeeding, your hormones that are functioning, the progesterone hormones, things like that, are protective towards your breast, and so that's the concept. But it doesn't mean that you can't get breast cancer just because you are breastfeeding. Breast cancers can happen in pregnant women, and breastfeeding mothers as well. And normally they are a bit more aggressive during that time, so they
I see.
obviously need to be really looked into urgently, because they tend to spread very quickly when you're pregnant or when you're breastfeeding.
I see. Okay. Wow, that's interesting. So
Yeah.
no, breastfeeding does not reduce the risk of breast cancer.
No, it doesn't. It doesn't.
Okay. Thank you. So Kwan Yen Man, she's a breast cancer survivor of 6 years. Kudos to you. She's doing her regular follow-up. So far, she says it's good. So, but what do you advise in terms of diet for any cancer survivors, for breast cancer survivors?
All I can say is eat well, eat healthy. There is no, how they say, pantang. I mean, a lot of people get so carried away with a lot of, the do's and the don'ts, and they make life very stressful. And try not to rely too much on supplements. There is no wonder drug or
Mm,
wonder supplement out there that is going to do any good to you. I mean, it's a lot of money that's being wasted on supplements. And I always tell patients a lot of these supplements have to be digested. So your liver actually ends up working overtime sometimes to digest all these unnecessary supplements. So just eat a good, well balanced meal, healthy, in moderation. You can eat everything, everything, but in moderation. Most important is be active, put in a good effort, regular exercises, which is so important to keep your muscle going, to prevent bone loss, keep your bone density going. Especially those who are getting older, menopause starts setting in, you start getting osteoporotic. All these are added things that you need to protect yourself. So eat well, exercise regularly, sleep well, reduce your stress levels as much as possible. Do whatever that you feel helps to do that. I think that's all you need to do, and don't make life difficult by say, oh, I have to eat this, I can't eat this. No, the whole family should be practicing the same, eating a good, well balanced meal, healthy, similar. There's no special diet for a cancer patient. There is none. You eat everything everyone else can eat, but eat well. That's all. Modify
eat,
your yes,
eat a well-balanced diet.
exactly.
Okay. Bharati asks, she says, hello. How does one understand BIRAD123 and the need for further reviews at what duration, please? Do you know what that means?
BIRAD.
Yeah, I
BIRAD
was
is
like,
the language we use for the X-rays, the mammogram.
okay.
And talk about BIRAD. So you have BIRAD 0, 1, 2, 3, 4, 5, 6. So when you talk about BIRADs, it's basically an international language that surgeons and radiologists speak so that we understand what it is. So if it's a BIRADS 1, it means it's a clear mammogram, nothing worrying. If it's a BIRADS 2, it means they see something, but it's more likely non-cancerous. If it's a
I see.
BIRADS 3, then it's something is there, more likely to be non-cancerous, but probably better to follow up. A BIRADS 4 means something suspicious that warrants, a biopsy or a further follow-up. BIRADS 5 means this looks like a cancer. So
Mm,
the language that we use, that's about it.
I
It's
see.
not something for you to get stressed out over. It's more for the surgeon and the radiologist to understand one another.
Okay. Thank you for clarifying that.
No
So,
problem.
Luna asks, Luna Yap says, she says hi, and she says she just stopped breastfeeding. So she says, does she need to go for a check to see if there's any more milk that remains in the breast and to get treated? Will breastfeeding affect the lumps that already existed in her breast years ago? Like, does it get bigger or smaller after breastfeeding?
Well, if you have a breast lump already, a pre-existing breast lump, it can grow or it may remain the same. There's no definite pattern that we can predict. Now, once you stop breastfeeding, my advice is usually wait for about 6 months before you do any imaging, meaning like a mammogram
Mm,
or ultrasound. As long as the breast is fine, that you don't feel anything suspicious, because it takes time for the breast to involute back to its normal before it's worthwhile doing these scans. Otherwise, the breast is still engorged, it's still full of milk. It can mask some things and you don't get a very clear picture. And of course, it can become a bit uncomfortable and painful doing a mammogram and you still have milk in the breast. So, and breast milk will remain in the breast for up to about a year or so. It will gradually get absorbed by your system. So, if you were to squeeze your nipples 6 months or 8 months later, you will still produce a little bit of milk. So never get alarmed. There is no problem with that. Your body will absorb the breast milk gradually, naturally.
Okay, interesting. I hope that answered your question, Luna. And one last question before I announce how to win the 3D mammogram and ultrasound. Eileen asks, does the radiation in mammogram, is that a cause for concern?
No, I mean, the radiation dose is actually quite low. It's not a high dose radiation. For you to do it once a year is perfectly safe. A lot of people don't realize that if you stand outside in the hot sun for 2 weeks, that's the same radiation as your mammogram. Or if you take a flight from Kuala Lumpur to London and back, the amount of radiation you expose on flight is more than your mammogram. So, so there, yeah, people don't say anything about flying, but about the mammogram. So, don't be too worried about the mammogram. I mean, you're not asked to do a mammogram every month or, frequently. It's once a year. And so that radiation dose is very safe.
Okay, that's good to note. Thank you so much, Dr. Harjit, for answering everyone's questions.
Most welcome.
Everyone says thank you and they really appreciate it. And there's a lot of praises for you as well. So thank you so much.
My pleasure. Thank you so much, Maisie, for doing what you're doing. Yeah, it's really, really very good. Yeah, I'm so glad to see you thriving, and I hope a lot of young ladies will emulate you. And
I,
yeah,
Thank you so much. And also for all of you who are, have yet to do your mammograms or ultrasounds, please go ahead and do them now. Like what Dr. Hajit said, it's always good to detect it early. Early detection is important. We don't need Pink October to remind us. It should be reminded to us every day of the year to care for our health. So how to win the 3D mammogram and ultrasound is to just share this video, share this episode of Talking Live with Macy and hashtag PCMC. Once again, share this Talking Live with Macy session on your Facebook and tag hashtag PCMC. And more importantly, put your Facebook to public so we can see it. For last week's winners, we'll announce it soon. All right. Thank you so much for joining us on today's stream. We hope that all of you are staying safe, staying healthy, and keeping active. All right. Thank you, Prince Court Medical Center, once again for the 3D mammogram and ultrasounds, and also for Dr. Harjit Kaur. Thank you so much, Doctor.
most welcome. My pleasure.
Thank you once again, and have a good evening.
Yes, you too. You too.
Thank you, everyone. Thanks, Dr. Harjit.
Bye.
Bye.